Well, good morning, everyone. Today is Monday, June 23rd, 2025. We're here this morning for a work session, and our discussion item is an update on Early Childhood Council of Larimer County and potential ballot measures. I'm Kristen Stevens, Chair of the Board of County Commissioners, with my fellow commissioners, Commissioner John Kafalis and Commissioner Jody Shattuck McNally. Also have our County Manager Lorinda Volker with us. And I will turn things over to Heather O'Hare, our Director of Human Services, to introduce the topic, and people can introduce themselves as they speak, but welcome everyone.
Good morning. Thank you, Commissioner. Heather O'Hare, Human Services Director. I'm actually going to turn it over to Christina and her team. We've had, I believe, one or two other work sessions prior to this, so it's an update on the work that the Early Childhood Council has been doing over the last 2 years or so, related most specifically to the MOU, although Christina will give you several years of information as they've been working on this topic for a very long time. So an update on the MOU that we have with the Early Childhood Council that goes through the end of this calendar year.
All right. Good morning. My name is Steve Kenneman. I'm the president of the board of directors of the Early Childhood Council of Larimer County. First, I'd like to thank the Board of Commissioners and county leadership staff for making the time this morning for this important work session. With me, I have the council's CEO, Christina Taylor, and the council's Chief Strategy Officer, Liz Means. And we look forward to presenting both the challenges and solutions for childcare in Larimer County. Specifically, we'll be making the case for public funding as a solution by putting forward a 0.25% sales tax on the ballot this November. And I'd like to hand it off to Christina. You already know this, I believe, but Christina's led the organization since 2019, significantly expanding the council's programs and impact during her tenure, while also laying the groundwork for the child care solution we are going to discuss today. So thanks.
Thank you, Steve. Morning, everybody. Commissioners, nice to see you all. I'm going to go through, as Heather mentioned, kind of the history of how we got here, just so that the folks watching and that haven't been living and breathing this for 4.5 years know why we are here and what we're aiming for. So, first question that I get asked all the time, why the heck do we care about early childhood? Why is this something that we even want to invest in? This is a very brief line, but it's important. A child that has affordable and quality early childhood education program will be better prepared for kindergarten, read earlier, be more likely to graduate high school and attend college, earn a higher wage, live a healthier life, and have better developed life skills. This is truly setting the foundation for our society, for those that are going to lead the way in the next generation. What's not on here is it also decreases the costs in social services. It decreases the amount of crime in the future when we are supporting children in the 0 to 5 range, giving them a better start. There is a crisis in Larimer County in care. Again, I know I'm preaching to the choir here, but it's important that we go through kind of all of this. We've identified 6 underlying factors contributing to the early child care crisis in Larimer County. First, of course, is cost of living in Larimer County. We are one of the higher communities in the state, as you know. Housing costs are exorbitant in our community. Cost of childcare is almost equal to housing costs in some cases. We'll go over kind of what that looks like in a little bit, but families are paying way too much of their annual income on childcare. There are childcare shortages across Larimer County. So we know we have about a quarter of the number of spots needed for our 3 to 5 range, or our 3 to 4 range. In our infant toddlers, we have about 1 in 5 slots available. So families that need childcare are unable to access it. Another key contributor is low pay and benefits for the ECE, or early care and education workforce. These are the educators that work within early childhood classrooms teaching our youngest. These are highly credentialed, very professional individuals that have gone through school to understand early childhood development, and yet they are making very often poverty wages. We continue to see an increase in population along the Front Range and in northern Colorado. And as I'm sure you are acutely aware, we have inadequate state and federal funding. One of the statistics that pops into my head all the time, in fact, I was conversing with a colleague in Denver recently that spent some time in Copenhagen. viewing their early childhood system, and she was talking about how amazing it was that they had this child-centered approach. And one of the points that I made in our conversation is that Copenhagen invests tens of thousands of dollars more per child per year than we do in the United States. We invest about $500 a year per kid. And so continues to be an inadequate investment in our youngest population. So as I said, we're going to go deeper into this. Cost of care. So the average cost of care in Larimer County is between $200 and $324 a week per child, depending on the age. It is higher for infants because it is a higher burden on educators, and the ratios are lower. So you have less children in a classroom per teacher because they need more care and attention. Larimer families spend an average of between 12 and 20% of their income on childcare for one child. This can go all the way up to 30 or 40% if they have more children. The U.S. Department of Human Services has recommended that childcare not account for more than 7% of a family's annual budget. And so we are far and above what it should cost families to be able to live a stable and well life. Lastly, a two-parent household with both parents working needs to make a minimum of $23 an hour each to survive in Larimer County, and minimum wage right now is $14.42. Childcare shortages, I previewed this a minute ago, but license capacity only meets about 16% of the population for children 0 to 18 months, and about 36% for children 18 to 36 months old. So one of the stories I like to tell when I talk about infant toddler care in particular is that we've had, probably 4 or 5 children born to the Early Childhood Council of Larimer County in the last 5 years. Not a single one of my staff was able to find childcare for their infant when they were born. And we are the most well-connected agency in Larimer County when it comes to knowing where to find childcare. So that really highlights for you just the total lack of infant care that exists in this community. Again, low pay and benefits for the early care and education, or ECE workforce, is huge. This is a big reason why we have a shortage in care, is because it's very difficult to keep educators in the classroom. Educators are making very low wages, often between, it used to be 13 to 15, I believe it's gone up to about $15 to $17 an hour. As I mentioned on a previous slide, you need to make at least $23 an hour just to be able to live in this community. So our educators are not making enough to live here, and that is a big part of the turnover in the workforce. The ECE workforce has about a 30% turnover rate, so almost double the national average for all industries. As I mentioned, ECE teachers are highly skilled and credentialed, yet they are in the bottom 2% of all occupations in the United States. That means 98% of workers in the United States make more than child care providers. I want to again highlight that these are individuals that have taken higher education classes to understand early childhood development, to really support the health and well-being and social emotional development of children, and they are making among the bottom 2% of occupations in the United States. The poverty rate for early childhood educators in Colorado is 15%. That is 8 times higher than that of K through 8 teachers. And this last one really gets to me. So child care centers would need to raise the rates, so what they charge families to bring their children into care, by 42% to be able to pay a living wage to early childhood educators. So if we had to raise that, say, $200 a week by 42%, just think of that burden on a family for one child. The increase in population and inadequate state and federal funding continues to be an issue. We predict that the population in Larimer County will increase by 37% in the next 25 years. I believe that's from the state demographer. The number of children under the age of 4 in Colorado is expected to increase by 22% in the next 2 years. And this last one is important. Childcare is a failed market that cannot sustain itself without dedicated public subsidization. For those that don't fully understand what failed market means, I'll explain it briefly. What the sole source of revenue in a child care program is the fees that a parent pays for their child to go there. And so, as I mentioned before, they're paying between $300 and $400 or $200 and $400 a week per child. There are no other revenue streams. There are some public funding streams that are coming in to support children to access that same care, but the only way to increase revenue in a child care program is to increase the fees that are being charged to families. And so as you can see, it is a failed market because we can increase the cost of child care for families because they can barely afford it now, but without increasing it, educators continue to make poverty wages. So now I'm going to talk a little bit about, I'm flipping the wrong slides, about Early Childhood Council of Larimer County and why we are here today and continue to push for this case. We've been around for 28 years, 28 years of trusted service to our community. We started in 1997 as one of only 12 consolidated child care pilots in the state. It was really a coalition of community volunteers meant to support and raise awareness around early care and education and the needs in the community. In 1999, we received our first funding, which allowed us to start growing the child care focus in Larimer County. In 2003, we became a 501c3, so we are an independent nonprofit and have been for more than 20 years now. We hired our first paid staff and began supporting the child care system more broadly. In 2006, early childhood councils were added to state statute. There are 35 early childhood councils throughout the state now that support every single county. We all differ in the way we do our work. Early Childhood Council of Larimer County is among the best and the most comprehensive in the work that we do. And we exist in state law. So state statute means that our agency exists in state law, and there are statutory requirements to how our organization is run, and I'll talk a little bit more about that in a bit. In 2021 is when we actually began exploring public funding for the ECE system. So if you're counting, it's been 4.5 years since we decided that this was really necessary and began diving deep into how we could make it happen. And in 2023, we celebrated 25 years as an independent 501c3. The work of the Early Childhood Council is guided by the Early Childhood Framework, which is established by the Early Childhood Council Leadership Commission. And so it's important to note all of the areas that our agency works on to support the early childhood system. At the bottom of that circle, you see the child. So we work heavily on supporting the health and well-being of children in particular. We have many services that support social emotional development, et cetera. Relationships, we provide direct assistance to families, educators, and caregivers to ensure that those individuals that are supporting our youngest population have what they need to thrive and therefore be healthy, well caregivers. We invest in quality environments, so we support childcare classrooms, individuals in their homes to provide high quality early care and education. And then we work heavily at the policy and advocacy level and local, state, and federal level to ensure that policy is working to support our youngest population. This is just a brief snapshot of who we are. We currently have, I believe, 18 staff. We have a couple newer positions that we're in the process of hiring. When we're fully hired up, we have about 22 staff. This gives you a picture of what we do. So we have a coaching program. We have a specialist consultation program, which includes mental health and occupational therapy. We are the local coordinating organization for universal preschool for the state. So we have a program dedicated to supporting universal preschool. We have a workforce manager and a workforce associate that are dedicated solely to recruiting and retaining early educators into the field. We have a community impact manager that really ensures that we are deeply connected to our community across all levels to ensure that our work remains community driven. As I mentioned earlier, there is statute that guides how our organization is ran, and a big part of how that works for us is that it defines our board of directors membership. So in state statute, many of these positions are required and ensure that we're very well connected to the community that we serve. We have representation from Colorado State University. We always have someone on our board from Estes Park, currently a member from the Estes Valley Investment in Childhood Success. We retain membership from Front Range Community College. We currently have a faculty professor. Larimer County Department of Human Services. Up until the end of this month, we have Thad Paul. Starting July 1st, we'll have Vanessa Fuel joining our board of directors representing Human Services. The Department of Health and Environment has a standing seat right now. We have Nicole Aguilar. Poudre School District and Thompson School District. The ECE directors of both of those school districts sit on our board of directors and support the work that we do every day. Summit Stone Health Partners, very importantly, parents with children under 5. Many of our long-term board members joined us when they first had children and have been with us for 10 years. That is the term limit, so those folks are terming off, but it shows you how dedicated our community is to staying involved in the work. Early care and education providers, right now I believe we have 3 or 4 individuals that run early care and education programs on the board of directors, and then family support agencies, so family resource centers, place like the Matthews House, things like that. We have a seat for them as well. I put this on here again just to demonstrate the deep connection the ECCLC, Early Childhood Council of Larimer County, has to Larimer County and the individuals that really work to support children 0 to 5. I might sneeze, give me a second. It went away. Just a brief snapshot of the work that we do. I'm not going to read this slide for you, but again, this kind of gives you an idea of everything that we do. We do a lot of recruitment and retention. We support caregivers. We design and pilot a lot of innovative programs. Really, that's what brought us here today in terms of really understanding what will work in the community. As I mentioned, we have expert coaching and quality improvement. When fully staffed, we have a couple coaches that are transitioning out because their husbands got transferred out of state. But we have 5 coaches that go within early care and education classrooms working directly with educators to improve quality in classroom practices. We have a mental health consulting team of 4 that work within early care and education classrooms and with parents to ensure that children's social emotional well-being is being cared for and supported. As I mentioned, we actually have a position that just opened new for us, an occupational therapy position that again will work in the same model within early care and education programs supporting the health and development of children 0 to 5. We oversee universal preschool. As you all know, because the Board of County Commissioners helped us launch this, the Larimer Child Care Connect Hub provides real-time data on available child care in Larimer County. We are experts in licensing, quality rating, and professional development information system work, or PDIS. We provide an employee assistance program to early educators, which allows them to access legal and therapy services for free. We provide training and professional development opportunities to early educators in a variety of ways. Most of my staff is trained in one professional development offering or another so that we can all provide training when it's needed in the community and ensure that educators maintain their credentials. We provide career and scholarship supports to the early care and education community to help professionals pursuing degrees, help them with their certifications, help them advance in their career, or just get into the field in general. We also help individuals start in-home child care businesses. So we have funding that supports individuals to go through pre-licensing training, to get CPR, first aid certification, medication administration. We help pay for some of those startup costs. We'll help provide materials to individuals to get care started in their home. I think I covered. We provide friend, family, and neighbor support, which is often referred to as unlicensed or license-exempt care. We provide extensive training through what we call a co-op of care, which again helps those individuals provide quality environments outside of the licensing process. And then we also support families directly. So we help families find childcare openings. We provide scholarships right now through the Larimer Child Care Fund. I believe we're distributing just over $500,000 this year in childcare scholarships directly to families. We have worked alongside all 3 school districts over the last several years to develop the Be Ready for Kindergarten program, which helps families kind of understand the benchmarks necessary to ensure their children are ready for kindergarten. And we also work and continue to work closely with our school districts to ensure that we are developing a warm handoff for ECE educators to send those 4-year-olds into kindergarten when they turn 5. Whew. So that's a big summary of who we are and what we do and why we are the ones showing up and asking for this. So as Steve previewed when we started, we believe that public funding is the solution to this crisis in our community. We've been working since 2021 on a tax initiative that would place a 0.25% sales tax, so 25 cents on $100, on the ballot for voters to approve. If approved, the initiative would raise around $28 million annually to support the early childhood system. This has the potential to dramatically improve the early childhood system for our community. So, as I mentioned, where would the money go? Approximately $28 million of voter-approved annual revenue if passed, which we would sunset after 20 years or take back to voters in 20 years. ECCLC was chosen to be an administrator of the funding through a competitive bidding process with the county, based on our longstanding service to the early childhood system in our community and our trusted relationship with families and providers. About 20% of the funding would be retained by Larimer County, and I'll let Heather talk to that in a moment. And then 80% of the funding, or approximately $22 million, would be contracted to the Early Childhood Council of Larimer County. This would be used to expand support to families, expand supports to providers, support capital projects to bring more care into the community, and fund administrative and evaluation expenses. And again, I'll provide more detail on that in a moment.
Okay, so the 20% that the county would retain, the vast majority of that would be put into reserves so that if there was a dip in the revenue in future years, that it could be used as you all directed to help keep some of those services that the council would administer from also then experiencing that dip and having to slow or stop services to providers or families. The funding would also then be used to cover the cost of a position. Based on your direction, this would happen through a contract that Human Services would administer with the council. And so we would have a staff member that would be added to our team to work directly with the council around the accounting and reimbursement processes, but then also be the direct liaison to you all so that you have the reports and the ongoing updates. There would be work sessions, so that staff member would take on all of that work. And then this could also then be utilized as you all directed to help the CCAP Child Care Assistance Program. As you all are very well aware, we are about 18 months into a freeze of that program. We are receiving a slight bump in our allocation for next year, but this could also then be used to help either slow down a wait list or freeze, depending on our budgetary constraints. And then it would also be able to better support the council's tuition subsidies so that they're not having to use tuition subsidies to serve CCAP eligible families that can't access CCAP. So it would also then help the tuition subsidies that the council administers so that families that are eligible for CCAP could hopefully then be able to access the program and not have to dip into subsidies or other funding streams that the council would have. I think that covers it for the county's portion.
The rest of the funding, about 80% or approximately $22 million annually, as I mentioned, would be contracted to the ECCLC. First and foremost, it would be used to increase educator wages. As I mentioned many times during this presentation, early educators in Larimer County are not paid enough to live here. That is a primary driver of our shortage of care in Larimer County. We are struggling to keep educators in the classroom, and we continue to hear directly from educators that low pay and benefits is one of the primary drivers. And so a big portion of this funding would be used to support educators to attain a self-sufficiency wage in Larimer County. It would be paid out in quarterly salary stipends paid directly to educators through their employer based on hours worked. We would also provide educator benefit supports, continue to invest in our employee assistance program and expand that, and provide health insurance supports to educators that are unable to access health insurance outside or with their employer. Another large portion of this funding would be to lower the cost of child care for Larimer County families. As I mentioned, early child care costs families between 15% and 30% of their annual income. This funding would be used to work to reduce the cost burden to 10% or less of a family's income through child care tuition supports. We would also support families with resource navigation and access, so continuing to invest in the child care portal, Larimer Child Care Connect, ensuring that we have early childhood navigators across the community that understand what resources are available to families and can help them navigate those resources easily and fluidly, and ensure that ongoing connection to county supports like SNAP, the Supplemental Nutrition Assistance Program, WIC, et cetera. We would also work to continue supporting quality early childhood environments. As I mentioned, our agency provides coaching, mental health, occupational therapy in classrooms, and material and capital improvements. We would continue to invest in those and be able to expand and reach more programs. We would also work to increase the supply of quality early childhood care through recruitment of new educators, through an expansion of scholarships and professional development, an expansion of shared service models and a substitute pool. Another way we know that educators struggle is they're unable to take time off. And so in order to be able to take time off when they're sick or have to care for children, they often will leave their job and go somewhere else. And so having subpools to help cover that time for educators will help keep them in the classroom. We would continue investing in a linguistic diversity fund. We already invest in this now in a small way to bring educators into the field that speak a language other than English, to ensure that families in Larimer County are able to access educators that look, speak, and have the same culture as them, and then invest in place-based training and degree programs. So why we're here is we intend to ask the Larimer Board of County Commissioners to refer a ballot question to the November 2025 ballot at an upcoming Administrative Matters meeting. We believe this is an important solution to our local child care challenges and that we can work together to make this happen.
Thank you, Christina, and thank you, Heather. Are there questions that we have? Commissioner Shattuck McNally.
Thank you, Madam Chair, and thank you, Heather and team, and thank you to Liz and Christine, and just appreciate you being here too, and the work that you're doing. I had a question about on one of the slides. It talked about early educator benefit supports, and it talked about health insurance supports. Can you expand on that a little bit? I know that could be a very expensive endeavor, and wondering what that looks like, and how many folks are you looking to serve? Because that could, I don't know, I don't see, when you say 80% of the funding for all these things, that could in years when rates go up and down, it's just really something out of a lot of our controllers' insurance rates. So I'm curious about that.
You are correct, and that's a great question. Thank you, Commissioner Shattuck McNally. So the way we've done the modeling in this, and I'm actually pulling up one of the appendices. For folks that are interested in looking at more of this data, you can go to larimerthriveby5.org. There is a report on there that really breaks a lot of this out. But the way we modeled health insurance benefit support is really providing a monthly offset. Again, probably through early educator's employer for tax purposes, but providing a monthly offset to reduce the cost of their health insurance. We could never, like $28 million is never going to cover the cost of health insurance for the thousands of educators that we have in our community. The idea behind it is that we can offset some of that cost so that they're able to afford it. And I currently have that modeled. We could reach about 1,500 individuals with a $50 a month offset, which is not a lot, but as we've done some wellness stipends through Early Childhood Council of Larimer County over the years, I believe we provided $120 a quarter, and it increased retention in a program significantly. And so we do know that even small things can help.
If I might, Madam Chair, when you talk, just because there's people listening in, when you say offset, that doesn't mean much from folks who are listening in, and also just trying to, for the members of the public and things, so you mean offset is just kind of like a stipend or assist for helping cover their things? Okay, and then you said you think you can cover 1,500? Mm-hmm. Okay, thank you.
I would add that we are currently piloting a program for our in-home providers with the Colorado Department of Early Childhood. We're working with Ally Health to provide not health insurance, but with their health benefits. So the pilot includes free access to virtual mental health and virtual urgent care, which includes, the mental health includes psychiatry appointments and psychology. So it's not quite full-blown health insurance, but it is greater access to some of those like essential services. People can be seen.
So it's just another example of how we could use this funding to expand access for educators. Thank you,
Thank
Liz.
you. Any other questions, Commissioner?
Yeah. So, thank you, Madam Chair. One other quick question is when you say work to reduce the cost burden to 10% or less of families' annual income through childcare tuition supports. So that would be kind of a sliding scale based on people's tuition. So there's some folks that might max out at 10%, but would there be still some families maybe that are still in that gap between maybe what a CCAP program would help and then that 10% when you talk about the need and the cost? And wondering if there's still a little bit of a gap of some of those families who are going to maybe fall into, and maybe there isn't a gap. I'm just, in my head, I picture a gap.
Yeah, so how we would model that sliding scale tuition assistance is really based on the work that they've been doing in the Denver preschool program for about 18 years. And it supports all families with some tuition support. Lower income families end up getting more because their income is lower, and so the amount that they can afford to pay, say if we're capping it at 10%, is lower, and so then the tuition subsidies would cover the rest. Our higher income families would likely receive less because their 10% is higher. So the idea is not that we're leaving anyone out in the cold, but that this sliding scale really supports folks where they're at in achieving a 10% max tuition rate.
But could you just give like an example? Let's say someone's making, I mean, I don't know, do you have examples of someone making, maybe minimum wage, and would that, like 10%, what would that be per month to help cover if they have just one child? Do you have any ideas? Just the number wise, sometimes for me, just understanding how much that covers, would it?
Sure. Yeah. So 10% of an individual that's making $40,000 a year would be $4,000. So anything above $4,000, we would hope to cover with tuition subsidies. So that $4,000 spread out throughout the year, I don't have a calculator in front of me, but that would be how much they would pay a month. And then above that, we would hope to cover it with tuition supports through this tax.
That's helpful, thank you.
Commissioner Kafalos, questions?
Yes, thank you. Thanks all. A couple of questions. The first one is, I seem to recall that you all were going to conduct some kind of survey, and we've not heard anything about that this morning. Can you give us an update, whatever you're able to share about the results of that survey?
Yes, happy to. Thank you, John, for bringing that up. Sure. So yes, we did. We've done voter polling 3 separate times over the last 4.5 years. That means that we are going out into the community through, this year it was text-based surveying of a representative sample of likely voters in Larimer County in the 25 election to ask them how they feel about raising their own taxes to fund early care and education. We fielded this poll in May of this year, so it actually went into the field the week of May 12th. And in our statistically significant sample that were polled, we do see a path to victory. So one thing that we've seen across all of our polls is that Larimer County voters really understand the issue of early care and education. They understand how it's impacting our economy, how it's impacting our educators, and how important it is that we fund it. In the last couple of years, folks have been feeling really anxious about the economy and weren't quite ready to say yes to raising their taxes for this. This year, while the path to victory is not as clear as we'd like it to be because the world is not as predictable as it used to be with various things going on in the world, but we do believe that with that there is a path and that we'd like to look to take us there. So we, in general, are looking for polling results that say our voters are willing, and we did get those results. Not quite as strong as we'd prefer, but again, I think given the way the world is right now and the uncertainty that everyone is facing, we believe we have a shot.
May I continue? Thank you. So related to that question, further ensuring a path to victory requires an effective and sustained education awareness campaign. How will that occur? Who will do that? And how will that be paid for?
Absolutely, yes. So we have been working with political consultants for the last 4.5 years. Those individuals have agreed to back us up. So if we choose to go, they will move us forward in a campaign. ECCLC, or Early Childhood Council of Larimer County, will not run a campaign. We are a 501c3, so we have limits on our lobbying. We will hand this off to a campaign committee when the commissioners refer, and it will be ran in that way through a C4 organization. In terms of funding for a campaign and our ability to do this, we have already secured more than half of campaign funds necessary to make this happen. We have a lot of folks that are very excited and interested in seeing this move forward, and so we feel very confident that we can fund a robust campaign.
Thanks again. May I do one more at this time? And I have a fourth one, but I'll wait if time allows. Thank you, Madam Chair. Let's see. On the matter of CCAP, I think I appreciate the 20% of the funding of the estimated 28 million would go to the county for administrative purposes, but also for reserves. And I think where I saw one of the bullet points said potential help for CCAP, I think that word potential is there because ultimately it would be up to us to decide. Related to what I just said, I'm wondering how much money would be required for us to lift the freeze. Is that a dollar amount that we can forecast? Because 5.7 million is a good amount of money, but I have a feeling it doesn't really. It might be chips away at things.
Very good question. It's still too early to project how much we would need for a variety of reasons. We very recently heard from Dr. Roy, the Executive Director of the State Department of Early Childhood, that they have received some messaging from the Assistant Secretary that is yet to be confirmed over the federal office, that the new administration intends to roll back those new federal requirements. That is what's adding, I would say, the most chaos to our budgetary constraints for Colorado. With those federal requirements, if those were to stay in place, we would need still $100 million to continue serving the families that we're serving today across the state. And today we're only serving 8 to 9% of the eligible population. So, but there are still some future changes that are coming because one of the budgetary issues for the CCAP program was actually an audit finding from 2021 that the state hadn't yet rectified. So that's the provider rate increase. So we had the first round of provider rate increases that went into place in October of 24. And then there's another round this October, and then the third round is October of 26. And then the state will be compliant with the federal requirements around how they determine provider rates within CCAP. So we actually just received the data, excuse me, for what the provider rate increases will look like this year. Last year was definitely the heaviest lift. And so we are seeing it scale down a little bit. Right now, it's really the infant providers that will see some of the biggest increases over the next 2 years. Some providers won't actually see an increase this year or next year because their rates came into compliance last year. So that piece is still happening. We are 18 months after, almost 18 months, our freeze went into place in February of 2024. We are, we've come within budget. So we were anticipated to be as much as $3 million overspent. The freeze has brought us back within budget, and then we are seeing a very slight bump in our allocation for next year. But again, not knowing the dollar amounts yet for the provider rate increases, it's too early to know when we might be able to shift to a wait list or how much money we would need. But we're still waiting on the confirmation from the federal office on what the new requirements might look like. Are they going to roll back all of them? Are they going to keep some? So until we know that, we won't know then how much we need. But I can say confidently that the roughly $5 million will not alleviate the issue. When we're only serving 8 to 9% now, we will need significantly more. And we continue to advocate both at the state and the federal level to make sure that those funding sources are providing the lion's share of that first. So more to come, but we won't likely have the data probably for 6 more months to see what projections would look like for the next couple of years.
Thank you. Commissioner Shattuck McNally.
Thank you, Heather. Now you spark more questions for me. First question, I'll just kind of work my way backwards. You said right now, because of the 100 million, it is what we would need, but really we're only serving 8 to 9% in Colorado. So does that also translate to 8 to 9% of Larimer County, or is that for Colorado? Because I'm sure some of the childcare deserts around the state kind of drag that percentage down. I'm just curious about that.
So that 8 to 9% is just statewide. We don't have, and unless Christina has more nuanced data, we haven't been able to get the data from the state for each individual county. So that statewide number is just across the state. And like you say, there are childcare deserts that impact that. But we know that we're likely not serving many more than the statewide average.
And I know this is kind of relating, but when you talk about the bump that we received, that was the really hard fought and heavily resourced and partnered, I'll call win-win for a lot of folks, but it's not a win for the budget because it's still a challenge. When you say a bump, and you say a slight bump, at least it doesn't really it helps us not have the needle going backwards. It maybe help kind of shift the needle going in the direction we need it to, but it really won't impact the freeze for now, because it's just to make sure we're not deficit spending. Would that be an accurate, do I have that an accurate statement? Just curious.
That's accurate.
Okay.
So we are analyzing it every month to see when we might be able to shift to a wait list. The biggest challenge with shifting to a wait list is that there are 3 additional subpopulations that would bypass a wait list. So there are populations we would have to serve under a wait list that we aren't, when you're on a freeze, no one comes onto the program under a freeze. It's a lot more gray when you're on a wait list. So there are 3 additional populations we would have to add, even with a wait list. So that's what we're constantly analyzing to try to figure out when might we be able to shift from a freeze to a wait list and what the impact to the budget would be.
Thanks, Madam Chair. I just have one last one, if I might. Thank you. So this is kind of for both of you, for Christina and Heather. Because of the CCAP freeze, and we're not alone, just for the public's information, I think at one time, almost every county was, or most of the counties were in a freeze.
I think there's 28 right now.
Which out of 64, that's quite a significant number. So I'm not sure who wants to answer this question. It says if we're helping with the CCAP, and then that would, just saying if, because we're still discussing this today, if the 20% helped with the CCAP and helping with some of those families, then that would free up some funding or some resources programming that's currently with the Childhood Council that's helping, Early Childhood Council helping support those families now. So if that was a pressure reliever on that portion that you're providing, what kind of, I don't know if you know exact numbers, I'm just trying to get an idea of the magnitude or the increase that would help to serve these other families who maybe don't qualify for CCAP. Does that make sense, my question?
I think so, yeah. Again, it's hard to give exact numbers knowing how many families are going to bring their children to care, what their income levels are, et cetera. But the way we've modeled this is that we believe we can invest about $11 million a year in providing tuition supports for families. And that has the potential to serve 6,000 families a year. Is it all families that will need it? No. This is not enough to solve the crisis. Some of the cost modeling that I've done with help from Brodsky Research is that we have a deficit in available funding in Larimer County in the $75 to $80 million range. And so this is one part of an overall solution to get our community closer to being able to afford childcare. Will it solve it? Absolutely not. Unfortunately, we can't raise taxes that much right now to make that happen.
Yeah, there's a lot of needs in the community
that
need some extra revenue too. So, okay, I think that's all I have today, for right now. Thanks, Madam Chair.
I would add to that with the tuition. We have a CCAP first policy with our Larimer Child Care Fund. So families go to CCAP first to see if they're eligible or can utilize that fund before they would dip in or utilize the Larimer Child Care Fund, and we would continue to have that going forward. That also includes like UPK. We want to make sure that the existing funding sources are being utilized before Larimer Child Care Fund.
UPK being Universal Preschool, for those that don't know.
Okay, I'm going to ask a couple questions here. With $11 million in tuition supports, do you, envision trying to help those who are in most need, or is it sort of a first come, first serve, whoever qualifies, or what kind of, is the goal to really try to hit people maybe in a lower income bracket that either are on a freeze and can't get in a CCAP or right at that margin? Because, I'm sure a lot of people ultimately, might spend more than 10% on childcare, and yet some people are more in a middle class where there's able to find other resources that they might have. And so, how do you envision that working?
Absolutely, yeah. So the idea is that any family in Larimer County that needs tuition support can access it based on that sliding scale. The reality is that we're going to have to work really hard to ensure that our lowest income families have access immediately. I think that will be a heavy partnership between myself and my agency and Department of Human Services to ensure that those families that are stuck on the wait list or can't get CCAP right now can get tapped in, as well as our partnerships with others around the community. So Larimer Child Care Fund, we've got a wait list that's been building there. We know that Poudre School District and Thompson School District teen parent programs have lists of girls that need to get on child care assistance so they can continue their education. And so it will really be through targeted support and outreach to ensure that our lowest income families are able to access. But the idea is that eventually this program gets to a place where it can serve as many families as possible while trying to alleviate that cost burden, because we know there are a lot of families in Larimer County that might be considered in the middle class that just can't afford childcare, because if you have 2 kids, it costs more than your mortgage.
Right, yeah. 10% of your income if you make $25,000 a
Oh,
year
right.
versus 10% of your income if you make $60,000 a year is a little bit of a different, not that I don't want to serve middle-class folks, because I do, but sometimes you have more resources available to you when you are middle class. So I think that, I think serving as many people as possible is really important. I just wondered how we would sort of triage that kind of situation. Another question I have is, and you talked about the benefits to families and children, which, absolutely there are benefits to families and children. Can you talk a little bit about the economic, why this is important economically to do this, why this is important for our workforce, economic health and security in our community?
I'd love to. Thank you for asking. I have, again, we have a report that, it'll be an updated report that goes on Larimer Thrive by 5, probably today or tomorrow, so I encourage folks that are interested to go and look on that. But we've got several pages of this report that really talk about the economic benefits in particular. The one piece that I really think is important to share is that the National Forum on Early Childhood Policy has estimated that investing in quality early childhood programs can yield a return of $4 to $9 per $1 invested. So that's significant. But what I want to say, and I'm going to scroll up in my little report here because I don't have all this memorized, unfortunately. The impact on our workforce, for instance, is huge. So 11% of working parents in Colorado turn down a job because of lack of childcare. 16% of employers in Colorado have seen employees leave for childcare reasons. 16% of the U.S. workforce are dependent on childcare in order to work. Colorado is closer to 20%. And a number that sticks out to me, almost 46,000 Colorado parents are making sacrifices in their career due to childcare issues. And then the opportunity cost here in Larimer County, this is based on data from the Council for a Strong America, that childcare shortages in Larimer County have resulted in nearly $100 million in lost earning productivity and revenue every year in Larimer County. $31 million in lost by employers in Larimer County annually, and an opportunity cost of over 900 jobs. So it has a huge impact on our economy. As Larimer County continues to grow and we're trying to attract a really high quality workforce to ensure that we have a vibrant community, access to childcare is pretty key in order for our employers to be able to attract folks. We've had conversations with employers all over Larimer County that come to us and say, I have all these people that we want to hire, but they have nowhere to take their kids and they won't move here. So this will have a huge impact on the growth in Larimer County that we want to see.
Thank you. I think that's really important for people to hear because sometimes people hear about a proposed tax, public funding, and they don't, well, I don't have, children in that age range, so why, but there are broader concerns. I mean, concerns about certainly the well-being and the education of these children is primarily important, but there is an economic case to be made as well. And I think that because of that, are you seeing a lot of support then from the business community?
Yes. I've been incredibly happy and impressed with our business community and how they've rallied around this as a solution. Folks continue to see that this is a huge economic driver in Larimer County, and I think a lot of our businesses are behind us on this, which is huge considering we're talking about a sales and use tax.
Right, I think that's important as we think about going forward as well. Any other questions for this panel?
I think I'll hold off. Maybe our county manager has a question or
Yeah,
some comments.
yeah.
More a comment than a question.
Please, go ahead.
So anyone who's been paying attention to this might remember 4.5 years ago, a group came and asked the board at the time if they might be willing to forward a tax. There wasn't much time to work out the administrative wrinkles there. And so just for historical purposes, the county published an RFP because the county would be the receiver of these funds. That's why the county is involved in this process. Tax funds can't flow directly to a nonprofit. We contract for those services. And so Early Childhood Council of Larimer County submitted a proposal, was selected, and has worked with Human Services on an MOU for exactly what this would look like. That's why there's so many details here today. So this is a well-informed plan. This is the plan that was polled. And so folks are understanding that the county's auditors will be involved in this process. The way that the funds are distributed will be evaluated. The county does maintain a reserve account. That is our policy for exactly the reasons Heather has described, so that we don't have ebbs and flows in funding and that we can continue a funding stream for the life of the tax should it pass. So I think any potential community members who are listening, who are interested in this, I think that the LarimerThriveBy5.org is a really great website to talk about what this can do in a lot greater detail. And if this tax passes, there'll be a contract in place. It'll be like any other vendor that we have. There'll be performance measures to hit. There'll be publications about status of funding and what is happening and how's funding being used. Because the county is involved, it will be as transparent as our other sales taxes are, which I think makes this a sustainable, kind of a service. The questions you're asking are all, I think, folks who are voting will ask as well. And so we wanted to give you a chance today to hear kind of where we are in the latest iteration of this. We do think it's a great partnership. The work with the Early Childhood Council has been outstanding. They've listened to our concerns. I think Heather has had the same experience. Heather and Christina have been joined at the hip for several years now, I think most recently months, especially as things change in this area. So we're not asking you today to refer this. This will come to an admin matters meeting, but you may have questions after today. Just let me know. I'll forward them to the group and we'll circle back so that you have whatever you need to be able to feel comfortable should you all choose to refer this probably in late July, early August as we address these issues.
Great, thank you. Well, that was a pretty, thank you for talking about the timeline because I think it's important for us to know, how much time we have to decide and get those further questions answered. So we're getting close on time here, so we'll probably wrap things up. But thank you, Christina and Steve and Liz, for being here. Appreciate your leadership in the space, Heather, Lori. This is, we've been discussing this, as was said, for a lot of years, and certainly there's a very, very strong case to be made of why we need public funding, especially in an environment where we're not seeing it maybe from the state or federal government, and we're dealing with these freezes. It becomes all the more clear that this may be the only path forward to be able to address this issue in our community. So I appreciate all the work that, I feel like Steve and Christina, maybe, I mean, this is, I don't know, I feel like I met with you all at, when you did a white paper. I mean, that was practically a decade ago. I don't know. I mean, we've been pushing this around for a long time. So thank you for this additional information. I think we'll be in touch with any further questions that we have. And yeah, and if there's anything else that you think of that we missed, or any questions that you think would be important for us to consider as we consider what we want to do, please forward those ahead. But it's exactly 12 o'clock on the dot, and so we'll adjourn for now. Thank you all.